In the Archives of Internal Medicine, there are two stories that help us understand the issue of whether social support relates to cardiovascular outcomes. In the first, researchers evaluated whether living alone is linked with cardiovascular outcomes. They used a large registry of stable outpatients with increased cardiovascular risk called REACH and followed patients for up to 4 years. For more than 8,500 people, living alone was associated with higher 4-year mortality at 14% versus 11% for those not living alone. Cardiovascular death was also higher at 8.6% versus 6.8%. Even more intriguing was the fact that among younger participants, living alone was associated with higher mortality, but this was not observed among older participants who were over 80. In an accompanying article, loneliness was shown to be a predictor of time to death and functional decline over 6 years. The difficulty, of course, with using social support and loneliness as an epidemiologic variable arises when trying to define these issues. For example, social support can be defined several ways. Generally, studies break social support into emotional, tangible, informational, and companionship support. However, it can also be divided into structural versus functional support, as well as perceived versus actual support, complex issues. Measures can be objective, such as living arrangements and the presence of caregivers, or subjective, such as feelings of belonging, perceived social support, and of course, feeling of loneliness. Remember also that social support can come from a number of sources, including family, friends, coworkers, neighbors, and pets. Regardless, it looks like there is some real fire underneath this smoke. Being alone, if you are young and feeling lonely, is not good for you. It looks like it might be a good idea to have friends, keep working, keep your wife, and have a dog. I'm Peter Block, and this is a CardioSource Heart Minute.